Hello. Yeah, let's talk about next gen Nclex. We know that the next generation Nclex questions is a new version of the Nclex that is designed to assess clinical judgment in nursing students. It includes certain unique questions that help to measure whether nurses can be able to think critically and understand how to care for their patient, in an appropriate manner. So let's just take this as an example of what the next gen NCLEX looks like. Let's get started. This is an example of the next gen question. The nurse is caring for a 12-year-old client. Now, this question composes of two sections. We have the history and physical examination, and then we also have the vital signs. So the history and physical examination reveals that the client, general assessment reveals that the client has a 2-day history of decreased appetite, nausea, vomiting, and headaches. The client also had a sore throat 2 weeks ago that resolved without any treatment. Interesting. The client's BMI is in the 65th percentile. Yeah, then if you check the eyes, the ears, nose, and the throat, it shows periorbital edema, no changes in vision. So it's just around the eye socket. In the lungs sound clear bilaterally, no increased work of breathing, no cough. Now, in the cardiovascular system, the S1 and S2 are heard on auscultation, no murmurs. There are 3 plus bilateral lower extremity edema. So this patient has lower extremity edema. Interesting. The GI, the bowel sound are present, no masses, no tenderness, detected during assessment. In the musculoskeletal, no joint pain and no swelling. In the genitourinary, there's decreased urination. The urine is dark cola colored. This is another clue that you need to pay attention to. All right, so they've given us the major details within this history and physical examination. However, we need more details, and we can see those from the vital signs section. So let us look at the vital signs of this patient and see what it looks like. Now, the temperature is 98.4 degree Fahrenheit or 36.9 degrees Celsius. The pulse rate is 98, okay? Respiratory rate is 20. Blood pressure is 158 over 98, and SpO2 is 98% on room air. So the vital signs looks relatively good. The temperature is a bit on the high side. Yeah, for somebody who has just had sore throat. Okay. The pulse is 98, even though it's still within normal range between 60 to 100. It is really on the higher side of normal. The respiratory rate is 20, which is okay. Yeah. The blood pressure is 158, 98, and the SpO2 is 98% on room air. Okay, let's see if we have any other information about this patient. Okay, they've also provided the laboratory values. I'm not sure if you can see this. The blood chemistry, the white blood count is within normal range. The platelets are normal. The BUN is increased. Creatinine is increased, okay, but the creatinine kinase is within normal range. Now, when they performed urinalysis, the color of the urine is cola colored. Remember, that was part of the history that we recorded earlier. Protein is about 50 milligram per dl, and the normal should be 0 to 6 milligram per dl. That is when a patient even has what we call the transient proteinuria. But this patient has way more than the upper limit, up to 50 milligram per DL. Now, bacteria is absent from the urine, so you are ruling out, an infectious process within the urinary tract. The leukocyte is also lower than it's 0, so there's no leukocyte. And then the RBC is there's presence of red blood cells in the urine. Now, these are the clues and the cues that have been provided in the stem of this question. Now, let us see the question they want us to answer. Now, which finding requires priority follow-up? Dark color colored urine, decreased appetite, hypertension, and periorbital edema. Now, this patient, you may think, yeah, this patient has dark color urine, decreased appetite, hypertension, and periorbital edema. But what should we pay attention to? What should be the priority, intervention? What situation requires priority intervention from this patient? Now, dark colored urine, yeah, it shows hematuria, which is also, of concern to an extent. Okay, decreased appetite, maybe. Yeah, decreased appetite can be caused by many situations. Yeah, it could be viral, it could be bacterial, it could be even just mere inflammation could also cause decreased appetite. But does it require, is it a priority at the moment? Maybe not. Now, what about hypertension? Maybe, let's see, which one among the four options require a high priority intervention? And the fourth one is periorbital edema. Something is really causing the periorbital edema, which has to be resolved, but it's still not a priority. Now, we've really examined each of these options, and the one that needs to be taken care of urgently among all the four options seem to be hypertension. Yeah, because when hypertension is resolved, the periorbital edema can also be resolved. But periorbital edema, even though it shows something is wrong, it does not necessarily mean that the patient may die or something drastic is going to happen to this patient right away. Now, decreased appetite can also be resolved, and it's not a priority, concern at the moment. Dark colored urine indicates gross hematuria. It is concerning actually for glomerular injury, so we need to, pay attention. However, there is no treatment for to reverse kidney injury. All we do most time is to do conservative management so that there won't be worsening of the condition, and then allow the kidney to recover on its own. So if you look at all this, hypertension should be given high priority, and that would be the best answer for this question. Now, the next question is this. The nurse has reviewed the information from the laboratory results. Which condition does the nurse suspect? We've reviewed all the laboratory tests, the urinalysis, and everything. Which condition do you suspect as a nurse that this patient may have? A is acute post-infectious glomerulonephritis. B is hemolytic uremic syndrome. C or 3 is rhabdomyolysis. And the fourth one is urinary tract infection. And let's start from the 4. Urinary tract infection is an infection that affects the urethra, the bladder, the ureter, and also the kidney. And its common manifestation is usually dysuria, urinary frequency, and urgency. Yeah, frequency, urgency. Yeah. Um, so in this case, urinalysis would reveal increased white blood count and presence of bacteria. But in this patient, there was no presence of bacteria in this patient. So yeah, that may not necessarily show urinalysis. Yeah. So we are ruling out urinalysis. What about the rhabdomyolysis, or whatever you want to call it? Yeah. This occurs when skeletal muscles break down. And when skeletal muscles break down, the end product, is actually going to release proteins that we call myoglobins. Of course, we know myoglobins are toxic to the kidneys. But then in this case, we'll see there will be something that tells us that this patient had a crush injury or had any drug toxicity or substance abuse. But these are not part of the questions or part of the information provided. So it's really not likely rhabdomyolysis. However, if it was rhabdomyolysis, creatinine kinase, the CK would have actually been elevated. But this patient, the creatinine kinase is still normal. What was elevated was the creatinine and the BUN. So we are ruling out rhabdomyolysis. Yeah, you can read up rhabdomyolysis. It occurs when somebody has crush injuries, the muscles are broken down, releases myoglobin. These are end product of the breakdown of certain muscles, especially the skeletal muscles. Now, what about hemolytic uremic syndrome? Um, most times when people have diarrheal syndrome or diarrheal illnesses, they end up having what we call the hemolytic uremic syndrome. In these patients, you will see thrombocytopenia. They may have destruction of red blood cells. That destruction, not gross hematuria, destruction of red blood cells, and then which can actually result in acute kidney injury. However, the patient, if the patient had hemolytic uremic syndrome, would have actually manifested with diarrhea or purpura or bruising and then oliguria. But the client will have no anemia or thrombocytopenia. I mean, this client does not have anemia and does not have thrombocytopenia. So we are actually ruling out hemolytic uremic syndrome. Now, A, which is acute post-infectious glomerulonephritis. We've seen certain history or information that really shows that this patient has glomerulonephritis. For example, when you hear that this patient, a patient had upper respiratory tract infection or streptococcal infection that was not treated and went on its own, it's most likely that there's something we call antigen antibody complex, which goes to the kidneys and starts destroying the glomeruli. So the body will develop an antigen to respond to the infectious, the body will develop, an antibody to destroy the infectious antigen. So this process will result into what we call the antigen antibody complex, and then it goes to the kidneys and starts destroying it excessively. So in this patient is having gross hematuria, and that's why there is dark colored urine. This patient is having periorbital edema. Now, periorbital edema in a patient with glomerulonephritis actually occurs when protein is eliminated through urine. When we pee so much of protein, the body loses what we call the oncotic pressure, because oncotic pressure is the pressure that keeps water within the intravascular space, within our blood vessels. So now the protein has been lost through urine. The blood can no longer hold water. The blood vessels can no longer hold water. So most of its water will escape into the interstitial space. And that is what protein does to hold water within the intravascular. But in this patient, peeing of protein hyperproteinuria, the patient has lost most of his protein through urine. So it clearly shows that the oncotic pressure is going to reduce and most of the fluids migrate into the interstitial space, causing edema, especially at the periorbital area. But typically, patients with glomerulonephritis may also have what we call anasaka, that is generalized body edema. And that's why most times when people have edema, or things like that, we give them colloid, we give them plasma protein, to replace the protein that they are supposed to have within their blood vessels. So when we give them protein, albumin rather, we give them albumin. When we give them albumin draws water back into the blood vessels, and that reduces the interstitial edema that the patient would have. Okay. Now, the next question says that the nurse is assisting the client to select food choices for lunch. Which of the following choices would be appropriate for the client's dietary needs? We have chicken nuggets, ketchup, and carrot stick. That's number one. We have the grilled ham and cheese sandwich with pretzel. Personally, I don't know what pretzel is, but let's keep it on one side. Yeah, because sometimes when they ask you a question, you may not know some of these foods that may be presented to you. But then your ability to think would give you the clue to the right answer. The third one is plain yogurt with oats, honey, and blueberries. Okay. The fourth one is slice of pepperoni pizza with a side of salad. And then the fifth one is wheat toast with unsalted peanuts, peanut butter, and banana. Now, look at all these food, and this is a select all that applies food. Apply question. Look at all these food classes and food categories. There's something unique about them. Now, if you look at them, some are natural, while some are, frozen foods, processed foods, and generally processed foods contain high amounts of protein, right? So in this case, we do not want a patient. No, sorry, processed food contains high amount of salt, that is sodium. In this case, we do not want this patient to eat food that is high in salt or high in sodium. And again, a patient with this condition, I'm sure you wouldn't want to give him or her processed foods such as chicken nuggets and ketchups. I'm sure you wouldn't want to give this patient grilled ham and cheese sandwich. These are processed foods that would contain high amount of protein. Okay. Now, plain yogurt with oat, honey, and blueberry actually sounds natural. It sounds natural. So I would choose number 3. Let's continue. Slice of pepperoni pizza with a side of salad. That is a no, 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 because it's processed. It is fast food, and then it also contains high amount of sodium. The fifth one says wheat toast with unsalted peanut butter and banana. This also is natural. So you can see it may look confusing originally, but when you look at it, these are, you just have to group them into what is allowed or admissible and what is not admissible for a patient with glomerulonephritis. And we know for kidney issue, we also want to avoid too much of salt. And this patient has intravascular hypovolemia. So we wouldn't want to concentrate the blood with salt. That we wouldn't want to do. So I would choose question 3 and question 4, and they sound more appropriate than the other ones.